Yeah, I tell you, when I tell you there's a whole lot to learn about life using a wheelchair, it's an understatement. Understatement. So much you have to depend on to make sure that you remember what you're supposed to do when you go to the bathroom, for the shower, to the toilet, because there's a lot of things that, devices and apparatus that you have to use to wash yourself, make yourself, and safely. Now, Sharon's here most of the time, especially early in the morning. She can help me transfer to the commode, because it's transferring to the commode from a wheelchair. It can be it's sensitive, especially if you're not no old pro at it. I'm not an old pro, I'm just old. That's okay. We're going to be all right. Sharon says I'm getting better. I like her words of encouragement too, because she said, "You getting better, baby." I'm like, okay, thank you, sweetie. But yeah, it's a lot to remember. The strategy, the whole layout. Now, what's really got me going here is incontinence. Oh my God. This morning, it started off to being an awesome morning. Got up at like 6 o'clock, rolled out, got my boots on. I got to wear these POD boots. Let me show you what they look like here. Let me see if I can get a picture of them here. I don't know, maybe you got a good picture of them, but those boots that I'm wearing are supposed to, one, keep pressure off of certain points, like your heels of your feet. I have forgotten 3 days in a row not to prop my feet up on pillows while I'm laying on my back, because generally you're laying on your back all of the time with the spinal cord injury. You can lay on your stomach, but it's very, very uncomfortable. But when you're laying on your back, you have to prop your feet up so you don't end up with pressure wounds. I didn't do it for 3 days, and I've got pressure wounds on my heels of my feet that are about the size of 2-inch in diameter circle. And those are like big blisters that if they open up, it could be a very infectious component, and it could go to the bone. And talking about shutting you down. Oh my God. It's just because there is no blood circulating through there, and the heavy weight of your feet, and the bone wants to go down to the mattress, because there's nothing but skin tissue between the bone and the mattress. So I end up with these big old heel wounds. I went over to the wound care center the other day, and the nurse practitioner over there, she used some different gauze and showed me and Sharon how to wrap them up, but then told me to wear these big boots like 24/7, to keep the pressure off of them. So I'm sleeping in them every now and then. And sometimes they're just so uncomfortable, I just have to take them off one night or one evening or a couple hours into my sleep, just so I can sleep. And that's in between the 4-hour catheterization that you have to do. I don't know, some of you know what catheterization is. Catheterization basically is where you take this 15-inch clear vinyl rod and stick it up your penis and let it drain your bladder, so you don't end up with a infection inside your system going toward your kidneys. So, and being that you don't have a control over how you urinate, they call it voiding in a professional term. You got to go and cath every 4 hours. So I set my alarm clock for every 4 hours to catheterization myself and let out about 200 liters of liquid urine. TMI, but no, it's real. And some people need to know, in the event they're taking care of a loved one who is a wheelchair user and they may not be keeping up with their protocol for medication and what have you. So it's a necessary component. Tomorrow I'm going to a rehab center, outpatient rehab center, being that the one program can't get me in until probably next week, and I need some constant rehab, physical therapy. I'm going over to, I guess it's called University Health now, what we used to just call Truman Medical Center over in Lee Summit. So I'll spend a couple hours there tomorrow seeing, that's Tuesday, to see if I can get part of their rigorous program to loosen up my joints. Because you take 3 days of not having some physical therapy, real physical therapy, your legs and your muscles start locking up like old rusty hinges. And when you're laying in the bed and you're trying to make sure you don't scoot your heels around, even though they're bandaged up and gauzed up, you don't know what kind of damage you could be sustaining up underneath there. So you're careful to lean forward and lift up your ankles in the bed. And when those legs are stiff, they feel like they weigh 50 pounds apiece. And you're bending over trying to pick them up with your wrist all the way down to the ankle. It's an odd situation, but it's something that I'm capable of doing. God gave me some flexibility. I got my arm strength and my mind is still straight and right. So what else is there to do besides, live this thing, live through it, open with God with the mercy and grace that He's sparing me with. But this is real stuff here. This incontinence, as I was saying, it is ain't nowhere near fun. Nowhere. Ain't nothing good about it whatsoever. To be 61 years old and having to wear a brief, just so you're not leaking and stinking because your bladder is trying to regain some substance, trying to regain ability to alert you, to let you know when you gotta go. Now my urge to let me know when I gotta go is, I gotta go, boom, and then it's peeing. Instead of, I think I might have to go, and I'm gonna hold it. With my core muscles gone, and I can't hold it like I wanna hold it. So you end up going into these briefs. I call them adult diapers, basically. But I know this too shall pass as well. Y'all ain't got to worry about me rolling up on you stinking or nothing now, because I'm as hyper vigilant about cleaning myself up as can be. I always have been, hopefully always will be. If I don't, maybe Sharon, she's got my back anyway. She don't want me stinking around her either. But this is just the life of a paraplegic. And I said that I was going to share the journey with y'all. So this is part of the journey. I'm sleeping in a hospital bed in the guest room so I can have the flexibility to elevate my feet above my heart and doing what it is that I need to do and not disturb Sharon while she's, trying to rest, because this is a big old burden. I don't want to call it a burden, but it is a big lifestyle change for my wife. It's huge. I know I'm the one who's got the physical disability, but mentally, on my wife, wow. And she's like, I asked her the other day, would you do this again? And she said, yes. I'm like, would you take care of me if I'm in a situation like this? This happen again? She said, yes. And I can actually tell you folks, today, after I urinated on myself about 2 or 3 times and changed, the first time ever coming out of my mouth was ever in 61 years is, I hate my life right now. That's a negative statement. I hate my life right now. But I said it, and I still pulled out of it, clean myself up, have to call on God to let him know I ain't complaining. I'm not I want to be here. I want his option to give me the opportunity to have full restoration or be the best I can be at whatever level of recovery that I can get back. That's part of the journey today. I got a lot of still pictures. I'm gonna figure out how to put still pictures with a video. But until then, y'all take care of each other, love on each other, and I love you all, Facebook. And thank you for the support that you've been giving to my GoFundMe page. I still need more. We still need more resources because right now, money goes fast on these medical bills. They're coming in now. The ones that the insurance doesn't take care of, it's rolling in. I know I'm going to be able to get my churn of work back because God left me with my brain. But right now, living with this situation, it is so trying that I feel like I'm so off base. But please continue to pray for me and continue to help us where you can, support-wise. My voice is going away because it does that after so many minutes. But God bless you all. Bye.